Well, good morning, everyone, and welcome to the morning show right here on Main Street TV, where it is a glorious day in Southern Ohio.
True.
And we have our friend Kim here from the health department.
Yes, thank you.
Welcome.
Thank you very much. It's a pleasure to be here.
Yes, and you were supposed to have a counterpart, but she's a little thick.
Yeah.
A little under the weather.
Under the weather.
We'll let her off the hook.
Yeah, I think we should.
Yeah.
Yeah.
Like,
Grace is extended.
By that, we say stay away from us because we don't want to be sick either.
That's right.
No, the worst time, and you are a nurse practitioner, right?
I am.
And so you have to know about these summertime colds that people get or whatever. You just can't get rid of them. I don't know what it is.
They do tend to drag on, I think, and I think we want to feel good in the summer.
I think so, and we have no patience for being sick in the summer.
That's correct.
In the winter, you don't have anything else to do, so whatever. You just wallow in your misery.
That's right. That's right. It does seem to drag on in the summer. We all have things to do.
I know. We want to be outside. We want to be doing our gardens and all of the fun stuff. And
right.
But anyway, so we have all kind of things that we're going to talk about this morning, and services that the health department offers. So
that's correct.
We're so happy to have you here.
Yes, thank you. I appreciate that.
Yes. Well, I'll tell you what. Adrian says we have to play a message, so we'll do that, and then we will be back and talk with the health department, find out about all the fun stuff going on right now. So just stay tuned. We'll be right back.
At Vinton County National Bank, we believe in supporting the areas where we live and work. Now, we'd like to honor those who also serve our communities. Our new Community Champions account is especially for first responders, veterans, active military, and anyone employed in the fields of healthcare or education. This account offers rewards, discounts, and other benefits to those who give so much to others. Vinton County National Bank, rewarding those who serve.
All right, and we are back with our friend Kim from the health department. And so what's your official title there?
Well, so my name is Kim Hughes, and I actually am working kind of a dual position there right now. I am the nurse practitioner, and so I see patients in the clinic for various and sundry reasons. I'm a family nurse practitioner by education.
Okay.
And so anything in primary care that you can be seen for, that's
Sure.
what I do. Then we have a vacancy we had a vacancy in the director of nursing position. And
Okay.
For this time, I'm actually filling that role as well.
Oh, my.
And yeah, it has kept me busy.
bet.
Yes. So I like to stay busy, and probably due to just the amount of patients that we serve at the health department, then part-time in both of those roles is probably appropriate at this time.
Got
So,
you.
Yeah,
I get it. Well,
Yes.
yeah, two hats is tough.
it is.
But you do like to stay, but you're not one to let grass grow under your feet.
No,
I know
no.
that. So I think a lot of people don't know. Okay, number one, we'll talk about where the health department is, because I feel like it was the same place for 750 years, and now you all have moved. So we need to talk about that. But I think a lot of people don't know that you can, which makes no sense, go to the health department for services,
Yes.
to be seen
Correct.
if you're feeling under the weather or whatever. So let's talk about the move first. And how long has that been now?
It's been over a year ago, and you
Wow.
are right. We were there for 750 years.
Yes, in the same building.
That's correct.
Yep, uh-huh.
And we still have people show up at the door 15 minutes late saying, I didn't know you had moved. But we are located at 102 Twin Oaks Drive.
Yes.
Just directly across from Holzer Hospital in Jackson.
Correct. So if you know, like where Wagner Rental, where they
Yes.
built it's Sunbelt now, I
Yes,
think.
yes.
But out that way across from the hospital, that's where you moved to.
Correct.
And
I
it's
think it was the West Banco or the PNC Banco.
it was.
Yeah. Yeah. I can't remember really.
It was
been so
it was
long.
something.
Yes. Yes.
It was a bank something.
Yes, that's correct. Yes.
We're gonna go with that.
Yes. So we have a lovely building.
Yes.
So very thankful. You know, the old health department building had become very dated, and it was just very. That was made on the part of the health department to get that new building. We
Yes.
have wonderful, beautiful clinic rooms and just a better atmosphere for people to come who are
Yeah.
seeking care or seeking health department services.
Sure. And the thing is, just humans, we outgrow spaces or our needs change as time goes on. And
Correct.
it's kind of like when you're talking about, in the city of Jackson here, the memorial building. It was built for XYZ 750 years ago, it seems like. And, sometimes you outgrow the space or your needs change. So, and sometimes it's easier to just make a change than to try to
Correct.
fit a round peg in a square hole or
Correct.
whatever you
Yes.
would say. So that's what you did, and I think it's really, really cool. So let's talk about some of the services that are offered. Like you and I were talking off the air about the fact that you have to get out of here because you have patients to see.
That's right.
But school is starting, so there's a lot of things that you have to do with that.
Yeah, so we have, this is a busy time of year for us, and we're gearing up for flu season. So,
Oh no.
yes, yeah, no one wants to hear that.
No.
No one wants to hear winter, and no one wants to hear flu season.
It's hard to believe when it's 95 degrees every day
It is.
outside.
It's hard
Yes.
to conceive of that. So,
Yeah.
but so the Jackson County Health Department about 2 years ago, maybe 3, they hired me as a nurse practitioner. Sometimes I think that it's hard to advertise anymore. Once upon a time, you put things on the radio, you put things in a newspaper.
It's like there's so much out there that
Yes.
it's hard for people to concentrate and to know where to go to
Yes.
find out information.
Yeah,
You're right.
not everyone reads the paper.
Correct.
Not everyone listens to local radio stations. And so advertising has become more challenging.
Sure.
So we adopted a model where we would provide, healthcare services for individuals who were, seeking care.
Okay.
Didn't have a regular provider, or who just might need something like an urgent care sick visit.
You wake up and you feel like tar and you need
Yes.
you just want to go be seen.
That's right. That's
Yeah.
right. And so we offer those walk-in services, as well as then care for individuals who are struggling with health care problems, chronic disease, hypertension, high cholesterol, high blood pressure, diabetes.
Sure.
So we take care of individuals starting at age 0 up to 105 or 10 or whatever, may be the case. So through the lifespan. And happy to see anyone, little people, big people. But we do offer our services Monday through Friday, 8 to 4. And we also have some extended hours on Thursdays by appointment.
Oh, you do? Okay.
We do, yes.
Okay.
So we're open until 7 on Thursday evenings.
Oh, well, that's
So
very
that's
convenient.
Yeah, very convenient for folks that are working and want to be seen outside of normal business hours.
Yeah.
Another thing that's going on right now: back to school immunizations. That's a big one.
It is.
Yes.
I mean, you have your hands full with that.
We do. We've seen a big uptick in our numbers based on those, the healthcare needs that people have right now. So.
And so is this an insurance situation, just as if you would go to Holzer or you would go to Adena or whatever? Do you come in and be seen just like that?
Sure. So we accept patients who have healthcare insurance, private insurers, as well as Medicare and Medicaid.
Okay.
So we'll see anyone with that is, has those insurers. Plus, we have a self-pay visit schedule.
Okay.
And we offer services based on income. So we do use a
That's
sliding scale fee.
amazing.
Yeah, because our goal is not to take patients from any other providers. It's to serve those who are underserved. That's where the heart of the health department and me. That's where I feel like I provide the best care for people in Jackson County and the surrounding counties.
There are so many people that fall through that crack for whatever reason it may be. And I know that I think by law we're all supposed to have health care and whatever. Well, that's easier said than done. Times are tough and everything's expensive, and a lot of people just can't afford the health care.
That's correct.
They can't.
That's correct.
Which is insane to me. I'm sure as a health provider, that's really annoying to you as well.
It is. It is. It's
Everybody should be their best self.
Correct. Yeah. And I think that people are in positions due to the economy and things like that to where you choose, do I put gas in my car or do I, pay for my prescriptions? And so it becomes difficult for people to, procure health care.
Absolutely.
And so we want to offer the ability for them to do that based on a fair self-pay fee.
Sure.
As well as using that sliding scale fee and taking things into consideration that other places just might not be able to.
Right, because they're a business. And you understand that. The people have to pay their bills too.
Correct.
So
That's
and
correct.
you get that, but
Yeah.
here you are.
And we want them to do that because then
Sure.
they can offer us the best things. They can keep their equipment updated. They can keep their providers paid, their staff paid, because we all will at some point need those services.
Yes.
So we want them to be successful. But we are willing to do what we can for those individuals who, like you said, fall through those cracks.
Yes.
One of the things that we work on through a grant through the Ohio Department of Health is reproductive health. So that includes individuals who need birth control or who may want sexually transmitted infection testing or need treatment for something like that, or who may need pregnancy testing or just some counseling and help navigating either the healthcare system or maybe even the job and family services system. We are working with a grant on those services, and that is, we encourage people. If you find yourself in the situation where you need help with any reproductive health issue, please come see us. Even if we need to refer you on, we will gladly get that process started. So
Okay. And without getting into a big discussion, because we could do a 2-hour program on this, but the sexually transmitted diseases, I know in talking with some healthcare folks, are certainly on the rise.
that's correct.
I know you see it.
Yes.
And it would be a lot better if people would get treatment or preventative measures to
Correct.
keep from spreading to others.
Yes, and we offer those things at the health
Exactly.
department. So, and gladly we'll take care of people, discuss that with them very, openly and honestly, and provide them what we are able. We have the benefit of being able to purchase medications, reproductive health medications, through a discount pharmacy, which is very helpful. So that means that those leave our place at a very discounted rate or free if the sliding scale fee and configuring those things is used to help with that. Also, through another place that I work, Grace Clinic in Wellston.
Yes, which is fantastic, by the way.
It is fantastic.
Yeah.
It's very good work.
Yeah.
We have access to a pharmacy in Athens, Ohio, that helps us assist people greatly with medications, either, and most of those are without charge. So we find ourselves as filling a gap, in care.
Love that.
Yeah, me too.
Your job has to just be so rewarding.
It is. It frustrating at times.
Yeah. Oh, yeah. Yeah.
Yes, but rewarding. And another thing that I think that we are good at the health department. So I'm going to plug pretty much everyone.
You do it.
Yes,
please.
Yes. We have the ability to. Because we're small and because we don't have large numbers that come through our door, I think that our services can be very personal in helping people navigate situations that are difficult. And that's done with compassion and kindness and non-judgmentally.
And discretion, which is
Very,
called,
yes.
back to what we were just talking about,
Yes.
some of the diseases and things like that. I know
Yes.
it's embarrassing for people.
It is.
So don't feel like it's coming to the health department is a great thing.
Yes. And like I said, I think that that's one of the words that I hear the most from individuals who come in is, I never feel judged, and everyone is kind to me. So I know that is pervasive, and the heart of healthcare should be, that. And I think that we do an exceptional job at that.
I think you do too.
Yes. And the other thing that we have started offering, which I think is a plus for our community, is we do offer Vivitrol. So Vivitrol is an injectable medication that helps assist people who struggle with, alcohol use disorder, as well as opioid use disorder.
So it's a deterrent, right? Or what does it do?
It is. So it is a medication that is used to help settle the cravings that individuals who are afflicted by alcohol use disorder and opioid use disorder struggle with. I don't know about you.
Listen,
Yes.
the struggles are real.
They are real. Yes.
You can get addicted to anything.
Yeah, Moose Tracks ice cream.
Yeah, right? Like,
Yeah.
I mean, it is, there's so many things that people can get addicted to.
Right.
And if you can get some help along the way, that's great.
That's right. And Vivitrol is a medicine that it's different than a lot of the other medicines that we use or that are used in other places. And everyone has their own individual need, but this is a little... It is a medication that, like I said, settles down those cravings and helps the individuals recuperate maybe some better decision making through time and abstinence from those situations.
Yes.
So, that there are other medications that other healthcare facilities provide that are different than Vivitrol, but that is one of the areas where we have found, that we are being successful in offering our clients that and hopefully assisting them on their road to recovery.
Anything that you can do to help someone or yourself and boost along the way is a great thing.
It is.
So the Vivitrol, how does it work? I was talking with someone the other day that said that they had been put on it.
Yeah.
And we kind of got into a little discussion, and then we went our separate ways, and so I was just curious as to how that works.
So I think that if I had to discuss it chemically, and
Sure.
I cannot. But the way that I explain it to individuals who come into the office is, oftentimes when you have something that you become, addicted to, or that you
Tracks ice
struggle.
cream. Yeah,
That's
I
right.
get it.
That's
I
right.
get it.
Yes. The limbic system of the brain, which is what drives those cravings,
Okay.
and that gets fired up or stimulated, and then it almost becomes a loop. That's what we want.
It's all you
That's
think
what
about.
We crave. That's
Yeah.
right. And then our frontal cortex, which is where we're to make decisions and make good decisions. That's this part of right. Hopefully. That part of our brain kind of just gets displaced or doesn't get
Overshadowed
used as much.
by-
That's right,
yeah.
by this system. And so the goal is to get rid of those cravings and let those settle down, silence them a little while you do counseling and go to group and get attached to a group of individuals through NA or AA along with counseling.
Yes.
To help our better judgment system along and until we are well.
Okay.
Or better. And so it that's the goal of Vivitrol. Nothing is without risk. So of course there are risks when you take any medication, but this one I think does provide people with a good opportunity to get well.
Maybe it's that boost that you need that you've never had before.
It's true, yeah.
I know a lot of people go to rehab or they do this and they fail and they fail and they fail. And then that's a whole thing on top of it, because then you just feel like a big fat failure. So if you can do something to just boost yourself over the hump a little bit, why not?
I think that we think about addiction, it is a relapsing disease, and the goal is to give the individual the best opportunity.
You got it.
That's to avoid relapses or have
them
less
help
relapses.
themselves.
That's right.
Yep.
And to help them along, to come alongside that individual and assist them, because we can't do this by ourselves.
No.
We just can't.
It takes an army, man.
That's right. It takes a whole community of folks.
Yes, it does.
And so, like I said, it's not for everyone, but it does provide another avenue for people
Sure.
to have the best chance. And so, when I think of anyone who has a chronic disease, ups and downs, ups and downs. You think of diabetes and high blood pressure. So addiction is a chronic disease. And so we need to find ways to manage that chronic disease just like we do any other.
We talk about that here sometimes when we have folks in and talking about mental health. And
It's true.
excuse me. It's like there's this stigma of, and a lot of times mental health and addiction, I feel like, go hand in hand, because you kind of try to mask the mental health with the substance. But, nobody, I don't have any trouble telling you I have diabetes or I have a cold or whatever, and I'm going to go to the doctor for it. But everybody seems to have trouble saying, I don't know, my brain is just, I have mental health issues. Why is that? You go get fixed for other things. Yeah. Why is there this stigma with that?
I don't know, and unless it's past judgment, past.
I think so.
Yeah,
I think that
lack of understanding.
Yeah.
We're afraid of what we don't get and understand, and so I think that immediately raises up, a barrier, and so then people feel like they cannot come and seek care. And that's like not what we're looking for.
An embarrassment or something.
Yeah.
And, and I've talked about this on the air publicly. Like, I started having horrible panic attacks when I was in college. And finally, talking with doctors and stuff, they said it's about the right time. It's just that age is and plus college can just do that to you.
Correct.
But so that's been something that I've had to really work on forever. But what I will tell you is that unless you experience that, I've had so many people say, just breathe. Like what you should be able to just do exercises or just calm yourself down. You know what's happening. Why can't you control it?
Yeah.
Yeah, well, unless you've experienced it,
Yes, that's right.
shut up.
Yeah.
Because
And
it is not something that you can just breathe sometimes and get yourself through.
it is not. And I sometimes they mean well. And in fact,
But that's so dismissive.
it is very dismissive.
Yeah.
And I think it's because they don't know how to
Yes.
help you, and that's what they want to do.
Yeah.
So I get, and then there are those individuals who are just dismissive,
Just
like
jerks.
you said, right? Yes,
Like-
yes. But I think that we all need to place ourselves in that individual's
Empathy,
place.
folks,
Yes.
empathy.
Correct. And that's hard if you've not experienced it, like
yeah.
you said.
It is.
I can sympathize with you,
Yeah.
but not necessarily empathize because I've never walked in your shoes.
Yeah.
So,
But the fact of the matter is just be, and this is with anything. It's not just mental health or panic attacks or addiction or whatever. Just know that the struggle is real and we're all struggling with God knows what, sometimes silently, and
It's true.
just be there for each other
Yeah.
and
Yes.
whatever.
Yes.
I don't know how I got off on that tangent other than I guess the addiction, because you said that I think a lot of times people feel really judged.
they do. They judged. They feel very out on the fringe of society.
Yeah.
And a lack of support. And so we strive at the health department.
Yes.
Not to do that.
Exactly.
At all. Yeah.
And everyone is welcome.
True.
No matter what your situation, it's a great place to start. And I know when Marsha stops by sometimes.
I love me some Marsha.
Oh gosh, how do you not love some Marsha? She's
right.
so great. And every time she comes in here, she's I just don't like doing this, and she just kills it every time.
Yes,
So,
yes.
because she's so much fun. But I think that she does a very good job of saying that you're all welcome, and there's so many services that you all offer that I think a lot of people don't know about. So let's talk about some of the maybe specialty things that you all can do that maybe people don't know about. But I do feel like you all are the concierge, and I say that because it's like start at the health department. Mm-hmm. If you don't know where to go, you don't know what's going on with you, you don't know whatever, start the health department. And you guys can send them on the way, or you can help them there, or whatever.
Yeah, we'll give it our best team effort.
That's great.
For sure. Yeah.
I mean, yeah.
Yes. So we offer the immunization services.
Back to that.
And
do you need appointments for that?
You do not. You can walk in, or you can schedule an appointment. Either way is fine.
Okay.
We offer, all of the children's immunizations, and as well as then the ones that you, when I say children, I mean the small kids. So preschool, infants, preschool, kindergarten. Then, of course, 7th and 12th grade shots, or 7th grade and senior shots. There are a certain set of boosters to your other immunizations that kids need to receive. And then kids or young adults who are going off to college. There are a couple of immunizations that are recommended, especially if they're going to be dorm living.
Isn't that like a meningitis and stuff like that?
It is, because we want to protect them against the most severe form of meningitis to keep them well.
I don't even remember that being a thing when I was in college.
It was probably a thing.
It was. I just don't remember it.
No, probably not.
Okay.
Okay.
Because I see the commercials now about that stuff. I'm like,
I think awareness has increased.
Okay, maybe that's
yes,
it.
Yes. So we also offer adult vaccines. We have Shingrix, which is the shingles vaccine. Of course, we'll have flu and COVID immunizations coming up soon.
Okay.
Those are ordered and they'll be shipped when they are, the manufacturers are ready.
Are those still separate?
They are. They are.
And with COVID, it's been.
Yeah.
I forgot all about it now.
Yes.
We lived 3 years of it, and
Yes.
I think everybody just wants it to don't ever want to hear about it again. But is that a yearly
It is.
thing, just like a flu shot?
It is.
Okay.
Very much so, and it's very much like the flu shot. They see the strains of COVID that they believe, are.
So it's a guessing game.
A
little bit.
I don't know the science of it,
Yeah.
so yeah, I'm certain that people way smarter than me figure this out, and so and then they come up with what is available for the COVID vaccine, and they are certainly recommending that folks who have comorbid conditions or individuals who are, elderly receive that immunization as well as the flu immunization.
Okay.
We had a really big flu season last year. We saw a lot of flu and
I'd heard
flu
that.
hospitalizations.
But the flu shot, I was told that the flu shot, they kind of nailed it last year. Like that, if you had gotten the flu shot, it was very helpful.
I believe that it was very helpful, and it you may have gotten the flu, but it would shorten the course of the flu. So we do have those available. TB testing. So we offer TB testing if you need one we see a lot of individuals who are going back to school and will be doing clinicals where they will be in contact with patients or working with clients who they need to be protected against, tuberculosis. Most employers and schools require TB testing, colleges, universities. Require TB testing, so we do that.
All right.
As well as we have our infectious disease nurse. That is Pat Woolham. She does a wonderful job.
Okay.
If you have a reportable disease that needs to be researched and needs to be followed.
What would be some examples of that?
Lyme's disease. We closely watch Lyme's disease cases.
Okay.
Other things, STIs, those are always traced because we need to get the individual treated as well as any partners.
Yeah.
And Lyme's
sure.
disease, because it can cause some devastating effects,
and again, that's like one of those things growing up that you heard about it, but nobody had Lyme disease. And then all of a sudden now and this whole alpha-gal and all that is out of control.
Yeah, it is. And we see it every month. We get our monthly statistics. Pat is tracing down those folks to find out if it was confirmed, if they were treated, and so she is doing that.
West Nile's another one, right?
Yes, yeah. There's a whole list.
Okay.
That we have that ODH sends us a report, and then Pat traces those back. Anyone hospitalized with flu, COVID cases, she makes sure that they are doing well, and if they're hospitalized, then that she's following them up to make sure that they continue to get well and that we're reporting adequately on those cases.
Okay.
We have another program which I love, and that is CMH. So it used to be BCMH, Bureau of Children with Medical Handicaps.
Okay.
And it's another fill in the gap kind of payer source for individuals, for families who have children or young adults up to the age of 26 with complicated medical conditions. Mary Catherine Shook the lady that deserted us, Jennifer.
The one that ditched us today.
Just kidding, Mary
You
Catherine.
just wait, Mary Catherine, until I see you.
Yes. Anyways, she follows those individuals and assists them with that program. And like I
Okay.
said, it's just another good way for us to help families
Sure.
who are struggling because they have children who have or young adults who have complicated medical conditions that require a lot of specialties, a lot of prescriptions, maybe special durable medical equipment, and it helps those parents with those situations or those caregivers.
Well, and once again, sometimes you just feel alone and that you're out there on this peninsula somewhere. And again, here
Correct.
you are, start at the health department,
Yes.
and you all can assist with that.
Yes, yeah.
You're not alone.
That it's true, and if we don't provide that service, we will try really hard to connect you with people who do. There are certain situations that we can't
Sure.
help with, but we sure will try. Marcia Radaball is my great resource person.
Marcia.
Yes, she's wonderful. And she will, help direct people, and she is willing to go that extra mile to dig in for resources. So,
Yeah, I put her on the case of something, and it took her a bit, and she called me back, and it was
Yeah.
a friend that I wanted to get some help for,
Sure.
and
Yeah.
called Marcia, and she
yeah, she
helped
will,
us along the way, and it
Yeah.
was great.
She will bird dog that
Man,
until,
she's
yeah.
like a dog with a bone.
That's right. That's right. Yeah, and I love that we have someone so willing to do that. We offer harm reduction, which is the safe syringe exchange. That's offered on Thursday evenings.
Speaking of no judgment,
Yes. Yes.
come on in.
That's right. That is correct. And the goal there is to provide individuals with safe equipment and hopefully also offer them the opportunity to research avenues that might help them to,
Help themselves.
that's right. That's
Yeah.
right. To those struggling with addiction. So that resource is there.
And the needle exchange isn't necessarily, it's there's a lot of people that use a lot of needles, or diabetics,
That's right.
all kind of stuff. So
Yes.
you can do that then too.
We do have people who bring their syringes in.
So they can be
Yes.
safely,
Yes, disposed of.
don't throw them in your trash
That's
can,
right. That's
'cause-
right. Yes. And then we have our clinic services and yeah, I think that's it. Well, on the other side of the building, I can speak to environmental health, and this is where my level of expertise just goes, ugh, because
That's where
those
Terry
folks-
and all the other
Correct.
folks come in.
Terry
yes.
and Gary and
Gary,
David,
yep,
and
yep.
they do a wonderful job, and they're also very helpful and try very hard to serve the public in our community.
They do, and there's a program I know that you all offer. If you have a septic tank that's not working properly, there's some money out there to help you fix it.
Yes,
Because
and-
that is not cheap.
Yes, it is not cheap. And do I know the ins and outs? And if I speak to it, oh goodness.
I just
yes.
know it exists.
It exists, and it's worth.
Call
if
the
you're-
health department.
That's right. If you are having that problem, it is worth a look-see to see if that money's available
Yes.
for those individuals. So I think sometimes that we're a well-kept secret.
Exactly, and that's
Yes.
why we're so happy that you're here today.
Yes.
And I'm so glad that you've been so forthcoming with all of this information,
Yes.
because
Sure.
you all do so much.
I think we do a good job. I think that we really strive every day to do a good job.
I think you do too.
Yes. So, and that's in our mission statement. And I think oftentimes with the individuals that I work with a wonderful MA. Her name is Tommy, and she is the epitome of I can talk to anyone about anything, and truly, I think that our staff's hearts are in the place that
Yeah.
we, really want to serve.
I think you're exactly right, 100%. And, we can't appreciate you enough. And I hope that the public does too. I was just sitting here thinking about some of the other things that I've utilized the health department for. Just like, in the business that I'm in, a tetanus shot is pretty much something that you should keep up to date on. But we should all probably keep up to date on those because you just never know when you're going to step on the rusty nail or whatever.
Yes.
So those are things that you could just stop by the health department, grab that tetanus shot, and you're out the door.
Right. And also, Jennifer, we offer a Tdap, which many places do, but that's important not only for the tetanus aspect, but what we have seen in our community is, and fortunately not as much in our community, but in other communities in Ohio, is an uprising of pertussis, whooping cough. And so
I had a staff member
that's right.
that they thought had whooping cough, and I was like, what?
Yes. Yeah.
Huh?
We think we've gotten rid of that because we don't see it.
You don't hear about it anymore.
But you are protecting little ones who are unimmunized or under-immunized. So any person who's a parent or a grandparent or a close relative or going to be a caregiver of an infant or a little child that may not be fully immunized.
Okay.
That pertussis immunization is actually not only protecting you as an individual from pertussis, but also that little one.
Which goes back to the kind of the COVID thing too, and all of that, where it's not necessarily about protecting yourself; it's about trying to protect others.
Yeah, because we have to be aware of that, and so we encourage people to get their immunizations when they're due, it just is. It protects us so that we don't see those diseases that we've not seen in a long time. Nobody wants to see a resurgence of polio or measles, mumps, rubella, diphtheria. We've not seen those. Not in our lifetimes.
Sure.
And thank God we have not seen those.
For sure.
But we want to continue to protect ourselves and our community.
Okay.
Okay.
So the pertussis and all, are those all individual immunizations?
They're not.
Back to that. What?
You can get one that covers tetanus, diphtheria, and pertussis in one shot. So it's called a Tdap.
That's what you were saying before.
Yes.
I wanted to kind of stress that because I think we didn't.
You can get just a tetanus or a tetanus and diphtheria. As we get older, they change the emphasis on what we get because we don't need to worry about. If you get pertussis, you're going to feel bad, but it's not going to make you as sick as it would an infant with that's just a little tiny thing with lungs that are still getting acclimated to the world and airways that are small. So you might feel really bad and you might cough for a long time, but you as a healthy individual are not going to get sick to the point of hospitalization. And so, that's where they change those formulations up and we get a different vaccine, but it still protects.
Okay, very good.
Yes.
And I do have one more question because I do know you need to see patients. Yes. And Pete Wilson's in the house,
Yay!
So we're going to party with some news here in a little bit. The shingles shot, as someone that just turned 50 years old, what are the shingles shots ages, and are there vaccinations that I should be boosting myself with?
Yes, and those, this is where Mary Catherine's expertise really does come in.
Well, if she would have shown up today, we could have asked her that.
That's right. Yes.
Oh, you just wait.
Yeah. Next time see her.
We're teasing you,
Yes,
honey.
we are.
She's not feeling well.
No, she is not. But so those, there's a set of circumstances, and I cannot quote ages. You are welcome to call us.
Okay.
And we will let you know. But certain immunizations are recommended for people 50 and above, and then sometimes even 50 with certain conditions, and sometimes younger than 50 with certain conditions.
Sure.
So the CDC puts out a recommendation, and they change it often.
Okay.
And so,
of course they do.
Yeah, so I get out the book and start looking, through this, because we want to make sure that your insurance covers it. We don't want you stuck with a bill or anything like that. And we don't want to give you anything that you don't need right at that time, because we want to give it to you at the right time so that it protects you throughout the rest of your life.
Yeah.
That's right. And then we do want to offer you boosters when those are due as well. But if you are 50 and above, and there are pneumonia shots, shingle shots. There's the RSV, which used to be just itty bitty, kids that we protected against that. But now we're seeing, more evidence that our elderly population also can become very sick from that.
Okay.
So those shots are offered, and we will gladly speak with you about that over the phone. We do offer rabies vaccines for individuals who need it.
Okay.
And that's based on individual care due to exposure.
Sure.
And special circumstances there. But yeah, we offer the gamut of
yes, you do.
immunizations.
Well, Kim, this has been so very informative today, and thank you for taking 45 minutes out of your day when you should be, when you typically would be helping people along the way. But I feel like we hopefully helped some people along the way today, because now start with the health department.
Yeah, we have. It's good to make people aware of what's out there and available, and I appreciate the opportunity.
Absolutely, come back anytime.
Yeah, it was a pleasure and one of those good small town privileges that you get from being here.
Yeah,
so,
heck yeah. But okay, well, Twin Oaks Drive, the health department, Jackson County Health Department, lots and lots of services. You have a wonderful website too. You can check out things there, and there's all kind of information on it as well. So, all right. Well, Kim, thank you. Come back and see us anytime.
Thank you. It was a pleasure.
Of course.
It was good to see you, Jennifer.
You too. Well, I'll tell you what, we have a couple of messages, and then we'll be back with Pete Wilson and some news. So stay tuned.
From breaking news to heartwarming stories, the Telegram is your ticket to the latest buzz in town.
Read your daily dose of local headlines, sports, and entertainment and more, in hand and on paper.
Get a print and digital subscription for only $7.95 per month. Delivered fresh every Wednesday and Saturday.
Visit thetelegramnews.com or call 740-286-3023 today.
Don't just read the news, be a part of it.
Saturday, August 16th is Southern Rock Woodstock in the Gallipolis Fairgrounds. This event will feature 3 decades of original artists and legends, such as Leonard Skinner, 38 Special, and Molly Hatchet. In light of this event, Total Media will be giving away 4 VIP tickets. For a chance to win these exclusive passes, comment your favorite Southern Rock song, and our staff will vote on which one is the best. Good luck, and may the best man rock out.
Did you know Jackson is home to a locally owned and operated full-service print shop? Zip Printing covers all your print, signage, and design needs. From business cards, booklets, and posters to yard signs, banners, screen-printed t-shirts, oversized signage, and more. We can help you or your business advertise and look good doing it. Zip Printing also offers logo design. Allow us to assist you in building or elevating your brand today. Zip Printing is located in the Stockmeister Plaza at 708 East Main Street in Jackson, Ohio. So stop in or give us a call at 740-286-3023.
All right, and we are back with our good friend Pete Wilson, who has a stack of news, and he is chomping at the bit to let you all know about what he has there.
Okay. Well, everybody's always interested, when a new business rolls into town or is on track to open. And we can tell you, and there's been lots of speculation about this, a lot of anticipation, the construction of the new Starbucks is underway.
What?
Yeah, there
Okay.
it is right there. There is evidence. The heavy excavation equipment is out there working.
I feel like we have coffee wars going on. Like we got two coffee things being built at the same time.
Right, we've got, of course, I'm not a shill for either Starbucks or Tim Hortons, so
Yep.
I'll mention both of them. And of course, downtown, locally owned, we have the Spot
yes.
on Main and Holy Grounds
Yep.
Coffee. So a lot of options, not to mention about any other convenience store, fast food, or sit-down restaurant has coffee too. So
That's true.
Lots of
Not a
options.
lack of
And you
coffee.
can get your Keurig and do it yourself, of
Yeah.
course. But Starbucks finally is getting going. News came out in January that Starbucks was going to put one of its world-famous coffee shops in town. It is located at 998 East Main Street. That is McCarty Crossing. Picture that there on East Main Street, just on the west side of that. Little access road goes down there, and excavation is taking place on one side of that road, and then it soon will on the other side. Now, there is no completion date for this because it's kind of a two-phase thing. The developer who I talked to, his name is Jared Decker. He is with the company called the PM Company out of Vienna, West Virginia. They've done other Starbucks, developers for Starbucks. Anyway, excavation, utility work, all that site preparation stuff going on now. That's going to take a little while. Then you will see walls go up, roof go on, all like that. When it gets to the interior work, they hand the baton off to the Starbucks people themselves, and they finish the interior work or oversee the interior work
Gotcha.
and design and decor, hire their employees, etc.
Are these all company-owned stores?
They can be both.
Okay.
They can be both, and it will be at very best late in the year when it opens, or early next year.
Okay.
Because that's how long it takes. They would like to have started sooner on construction, but as you know, it does take some time to get permits
Permits, plans, trust me, I know.
and be able to roll
It's a
and
nightmare.
like that. There's much more involved than just getting a schematic and
Yeah.
saying, okay, go start digging.
Yep.
So, but anyway, it is under track. It is underway now. Some folks kind of wondered, if something had fallen through. No, it didn't fall through. It just takes time. That's what I was told. So that is underway now. Of course, Tim Hortons got about a 2 or 3 week head start. They were even out doing some work on Sunday, I saw. So,
Oh, really?
So that, of course, is right between Bob Evans and the Ohio Valley Bank office, just very near here. But Starbucks, if you haven't heard of Starbucks, you've been under a rock.
Yeah, I don't.
Really, the company's not that old, but they just have taken off like crazy. They must have a great business concept. Started in Seattle, Washington. Now, believe it or not, there are 29,000 Starbucks, not only in this country, but internationally.
There's one on every corner.
78 total markets, whatever a market is. Starbucks has coffee shops in Waverly, Wheelersburg, Chillicothe, Athens, Logan, Portsmouth, Circleville, and South Point. So it's not like it's just a big city thing. It's just
No.
Jackson is getting its. And it will be coming soon, later this year, early next year. No completion date. When it gets a little closer, I'm told maybe in October, they might be able to pin that down. But it will still be a while, but you will see that it is coming.
Cool.
All right, on the other end of the equation, we have lost a fast food business, and that is Long John Silver's. Of course, we have reported that before. There is a look at the Long John Silver's at 448 East Main Street.
So sad.
Just across the street from Speedway there at the corner of Main and South almost. We learned just a couple weeks ago, July the 27th, July the 28th, that it was going to close. No announcement from the company or anything, but some of the employees let customers know on the 27th. It was acknowledged on the 28th that it was going to close. Been signs of trouble really for some time with the facility. Had trouble with heating and air conditioning to the point that the interior, the lobby, the sit-down places were not open. If you wanted Long John Silver's, you went through the drive-through. Then more recently, they've had supply problems with getting some of their product in. However, after it was announced that they were going to close, one of the busiest days they had in the drive-thru was the next day.
Oh, I'm sure it was.
People wanting to get that fried fish fix before it's gone. And that is really, if you look at our many choices, there's many places you can get fish, but that is the specialized,
Yep.
the only specialized place. And so it will be gone. It is gone. The last day was August the 9th, which was Saturday. That was the end of business. I do not know the ownership of that building, don't know what the plans are for the building, but obviously it doesn't look like anything else but a Long John Silver's right now.
It's so funny, you go up to like Columbus or something and you see where, I mean, they're so unique that it's like somebody tries to put another business in a Long John Silver's and it just looks like that. It's really hard to change those buildings around.
That is exactly right. Okay, well, tomorrow is the start of the school year in the Jackson City School District. Other school districts will be pretty much behind Jackson, but close behind. Jackson City schools start tomorrow, Wednesday, August the 13th. Christian Life Academy will start Monday, August the 18th. Buckeye Hills Career Center, and of course that draws students from 3 different counties, and home schools are involved in that, all the home schools, Jackson, Wellston, Oak Hill, and Vinton County here in our local area. But the first day for the Buckeye Hills Career Center down there near Rio Grande will be Friday.
Okay.
It's got its own day for a start. Next week on the 20th, that is a week from tomorrow, both the Wellston City Schools and the Vinton County local schools will have their first day. The Oak Hill Union local schools will start on Thursday, the 21st, a week from this coming Thursday. First day for students. We have a lot of back-to-school information that will be in our Wednesday paper.
Okay.
About policies, open houses for Oak Hill and Wellston schools because they're still out there a little bit. But one of the open houses through Wellston High School, I think, is even tomorrow evening. But they're spread out here over the next several days and into the start of next week. We received a lot of information from the Vinton County Local School District, everything you would want to know about the start of school there. If you have forgotten it all or you're new or whatever, very valuable information that they put together, and that is also in tomorrow's paper. Speaking of the start of school in the Jackson City schools, they renewed a practice that has been going on for a long time. The Jackson Rotary Club did this for many years, and now they don't do it. However, the tradition has continued, and that is the New Teachers Luncheon.
Oh.
They always have that on Friday before the start of the school year. Monday is an in-service day. But these are the new teachers for the Jackson City School District that we see pictured there. I'm going to give you some names because these people are going to be very important here in our local area. Also pictured are some of the administrators and representatives of the Jackson County Banking Center, the Vinton County National Bank, because they jumped in and sponsored the luncheon after the Rotary Club was no longer able to do that. But this tradition goes way back, Jennifer, years and years. And so I'm glad that they were able to continue. But it's a way for the new teachers to be treated to a lunch before they go to work. They get to introduce themselves. The administrators say, what their duties will be, what their assignments are, and it's just a get acquainted, casual thing. And then, of course, go to work the next Monday with in-service days, and they're going on yesterday and today as well. But those new teachers, but most of them are on the front row. From the left, he's not a new teacher. That's Doug Wooten. He's the Jackson High School principal, down in a football pose, as you can see. Then you have Madison Conley. She's the 3rd grade teacher at Westview. You have Jennifer Moore, a 4th grade intervention specialist at Southview. William Ridgway, a math teacher at Jackson Middle School. Alexandria Sheffer, a 5th grade intervention specialist at Westview. Emily Call, intervention specialist at Jackson Middle School. Eva Noggle, a 1st grade teacher at Westview. And then on the end, not a new face, but a new position, Adam Jones, who is the assistant principal at Jackson Middle School. And there on the very end on the right is Tyler Swackhammer, the Jackson High School principal. So good luck to all those students and teachers who will be beginning their new school year.
What is an intervention specialist? Is that like a guidance counselor?
Intervention specialist, I believe, you're putting me on the spot. I believe an intervention specialist works with some of the developmentally disabled students.
Okay. I know, they've changed names over the years, and I don't know
I believe
what
that,
some of that stuff means
I
now.
believe I'm in the right.
Okay.
I believe I'm in
Gotcha.
the right category there. Okay, some other things to report on. At the Jackson County Courthouse, there's going to be a huge project. We reported this last Saturday, and this is my first chance to talk about it on Main Street TV, but this will be a really nice addition to the downtown. The state, through the Ohio House of Representatives and the state Senate, provided money for a major park project next to the courthouse. This is the side of the courthouse where it's going to go.
Okay.
This is the section there. You see the big tree there, the cannon in the foreground, and like that. There's some monuments in the front that aren't shown in this picture, that are there. On the side, on the right side, you see a section of Broadway Street. But between that side of the courthouse and Broadway Street and that whole section back to Court Street, there's going to be a park. And Stockmeister Enterprises was awarded the contract for this. I think work will be getting underway soon. $659,998. So what will this park consist of? All right, it will. The statue of Governor Rhodes, which is on the other side of the courthouse, will be moved into that area. It will be the center of the new common space. The veterans memorials, which are in front, not shown in this photo, they will be moved, arranged in an organized way near the James Rhodes statue. The courthouse fountain, which is also in front of the courthouse, will be moved from its current place into the park. There will be significant renovations to that fountain, by the way, including a new stone facing, a new stone cap, an adhered water membrane, and more. There will also be a walkway with benches on which to sit, placed around the interior of a retaining wall, and the space will be lit with installed lights.
Cool.
All this will take place pretty soon. Contract has been let on that. The funding for the project, to be specific, was $300,000 from the Ohio House of Representatives and $300,000 from the Ohio Senate in a capital improvements grant. So some folks, who say, well, why are we spending all the local money on this? This is nice, but is that a good use of local tax money? It's not local tax money, not directly anyway.
Right.
This is state capital money where they allocate some money for projects like this so smaller communities can do them.
And if we don't get it, someone else will. So we're going to spend it. How's that?
That is very true. That is very true. Also, the State Highway Patrol has announced, they always like us to get this word out, but it's a little vague to begin with. There'll be a sobriety checkpoint later on this week. They usually end up having on Saturday, although they've not committed that that's the date.
Okay.
And they will never say exactly where it is. They may say a road, they may say a town, but they won't say exactly where it is. But later on, we'll get some more clues. But the point of the sobriety checkpoints, of course, is to catch drunken drivers and to dissuade drunken drivers before they might become a drunken driver.
Correct.
But there will be a sobriety checkpoint in one of our local counties, either Jackson or Vinton, later in the week, and I look for that to be on Saturday. So that is all I have to report. We'll have much more tomorrow, Jennifer.
All right. Well, thank you, Pete. Always a pleasure spending my morning with you, and we appreciate you coming in.
All right. Thank you very much.
All right. Well, have a great day, everyone. It's going to be another hot one out there, so just be careful, drink lots of water, and stay inside if you can. And we'll be right back here in the morning. So we thank you for watching, and we'll see you then. Bye-bye.
Bye.